Greetings. I'm Dr. Sunil Sazawal, Professor and Executive Director at Center for Public Health Kinetics, uh, and also heading the Center for Public Health Kinetics Global, which is registered and based in Zanzibar, Pemba. I have the pleasure in trying to talk about and recommend the application that is being prepared by some of our colleagues to in response to AI call from Google. Uh, a bit about the organization. Center for Public Health Kinetics is a non-profit organization, basically a research, an academic organization working in India and Zanzibar. It is registered in both places as independent entities and works closely with the Ministry of Health and Zahari in Zanzibar. Uh, has been doing so for the last 20 years. It's a fairly productive organization in India. It is as serves as one of the intent sites which is entrusted with training of local medical colleges in various parts of the country for clinical research. As a part of that activity of development of research competence in the country, we trained some of the colleagues in Jharkhand and this idea of developing a app for burns or attending to the burns came up, and that was the sort of an origin of this idea, and which has expanded. And since we also CPHK also has an MOU and close working relationship with IIT Madras Zanzibar campus as well as IIT Madras in India, which is a pioneer in applications of AI in the country. Uh, we have come together, the investigators from CPHK and from the medical college in Jharkhand and IIT Madras have come together for this application regarding development of AI-based tools eventually for diagnosis as well as management of the burns. Now, a bit about the background. The main problem, as far as burns in even in India, and especially in Africa for sure, you do not have in primary health care in district hospitals a, a separate burn unit. You do not have specialized people dealing with the burn injuries, and therefore the competence to handle, identify, diagnose, and treat burn injuries. On the other hand, burn injuries has a problem that you need to have quick response. I mean, the most of the action in burn injuries does take place or does not take place within first 72 hours, or within out of those 72 hours, first 24 hours are the most critical ones. Because of this lack of competence capacity, and also on the other hand, it's not something that you see every day. So a physician posted in a place might see a burn case once in a year, and it's possible that this is his first burn case or this is his second burn case. So it's an infrequent clinical condition, but with dire consequences, starting with mortality to high disability, and which is both social disability because of disfigurement, which is also functional disability because of strictures, because of loss of functionality. And a lot of that outcome, mortality, dysfunction, disfigurement, is all conditional upon how burn is managed, how well it is identified, diagnosed in first no presentation, and then how it is managed in first 24 hours. Now, so there isn't a scope for referring these patients to long distance tertiary care facilities where a burn specialist might be available. Now, this is the current situation, and this is the clinical dilemma in India, it's in Africa, it's in most of the global south that happens. On the other hand, global south is the place where you get most of the burn injuries. You get burn injuries because of kerosene fire. You get burn injuries because you're using, coal for cooking. You get burn injuries because of bad, regulations at the workplaces. You get burn injuries because of mishandling or free availability of corrosive substances like acids, like strong alkalis, like you also get burn injuries because of child labor and other causes, because of battery handling and all of those areas where you would normally have strong protections and strong regulations in the Western world. The populations in the global south are exposed to those conditions. Then there is a huge bunch of social uh, issues of or socio-cultural issues of burn, whether it is burning for self-molestation, whether it is burning for religious reasons, whether it is burning because of malintent. So the bottom line is that we have a lot of occurrence of the problem. We do not have adequately trained people uh, with experience available to attend to these patients at the places where they present, and they usually present either at the primary health care centers or district hospitals, uh, which do not have any units, do not have burn units. And the outcome or the consequences of bad diagnosis, incorrect diagnosis, and therefore bad management and incorrect management has a huge implication in terms of the outcome. Now, at the same time, burn is something which is, with the development of the sophistication of image analysis field, uh, a lot of progress has been made where you could create automated systems and train automated systems for image diagnosis, and therefore you would give into the hands of a peripheral worker an app or a tool whereby, with a simple picture or a scan of the burn and additional you know clinical features, he or she can very conveniently diagnose the extent of the burn and therefore opt to the management. Now, in this arena, uh, when we started thinking about it, we were more thinking about image analysis, diagnostic tool, availability of a tool to the person, where the correct classification of burn, characterization of burn, and therefore selection of the treatment protocol could be done. In the meantime, now, as the development of AI has happened, and especially our colleagues at IIT have taken that to the next level of being able to sort of help the medical system, the normal communication between the presenting patient and the physician or the health worker attending that patient, to be recorded in a native language, but uh, transformed with the help of AI into a medical history, into a medical symptomatology, into a medical recording, which then can also be amenable to investigating the medical databases and coming up with the management strategy, coming up with the potential complications of the case, coming up with whole lot of experience that is available out there, and is actually can be collected by the AI system itself and presented to the treating worker, whether it is a primary healthcare worker, whether it's a doctor at a primary healthcare center. Now, that presents a real change, potential changing intervention and structure uh, in this area, with a huge implication, with a huge application and uh, translational ability to be adapted and used in healthcare, in peripheral healthcare in these countries, with immense impact on both the mortality outcome as well as the long-term disability outcome of the burns. Therefore, I very strongly recommend uh, the current application being submitted by colleagues from CPHK and IIT Madras, Zanzibar, and Jharkhand medical colleges to Global AI for support, which I'm sure, if funded, would really advance this area to the next level. It would be a quantum leap, and it would also prevent a lot of misery in the human mankind in these countries. The intent here is very clear for using, and we have ability and access to the burn units and the burn specialists in India. We have ability and to use burn patients in Zanzibar, and again, these are two settings with different. You could also build into it the differences that occur because of the skin color, because of the texture, because of the local conditions. And Zanzibar particularly has another problem, that there is no burn unit in any hospital. There even in the tertiary care hospital. So you don't have a burn specialist anywhere other than going to Dar es Salaam or going somewhere else. So the project aims to collect images, train images, and then create an app. And what is very good about this project is that then, with integration of the image analysis capacity as well as the AI, getting it into a point where a single app or a single gadget can do everything. It can record the conversation between the presenting patient and the interviewer. It can record the data that is available. It can then record the image that is available. It can integrate all of that and make classification of the burn that is available, and then also go back to the management strategy and explain the management strategy in local language as well to the person. And that is really what we call it, high end or high impact use of AI for betterment of humanity. That's being discussed recently. Nandan Nilkhani basically said that the AI development can either be, sinking to the bottom or rising to the top, and this is one of the rising to the top uses of AI. Thank you.